Welcome to Mid-Manhattan Adult Learning Center's virtual family community resource fair. My name is Sula Haska, case manager and coordinator of this event. Mr. Carlos Rosas is also a case manager and our engineer today. We have a special guest who would like to say a few words. Please give a warm welcome to our assistant principal, Nancy Fernandez. Nancy Fernandez, welcome. You're muted, Ms. Fernandez.
Good morning, Mid-Manhattan Adult Learning Center family. I am honored, I am thrilled to welcome you to our virtual family resource fair. This is the first time ever, and we look forward to engaging you in a rich experience filled with lots of information and lots of resources about places and people that are there to provide you with the additional support that you and we all need to meet our goals. On behalf of Principal Williams, I want to wish everyone an exciting, fun-filled, informative experience. Please look forward to learning more about the resources that our partners, ranging from Cornell to free legal services to healthcare resources and other resources that provide support for our immigrants, our youth, our parents, and more. Thank you so much. Thank you, Ms. Haska.
Thank you, Assistant Principal Nancy Fernandez. We don't get a chance to see our administrators because a lot of us are working remotely. So now you have an opportunity to see one of our assistant principals. Thank you, Ms. Fernandez. We'll see you a little later.
Yeah.
Okay, so thank you for joining us today. This resource fair is being recorded. It will be available to be viewed again by using the same link. So before we begin, please place your first name, your last name, and your teacher's name in the chat box. This way you get credit for your attendance. Attendance is very important, okay? So the goal is to make sure you get the resources so that you bring it back home to your families, to your friends, to your neighbors. It's very important that you have this information. So there will be a lot of information. So feel free to take pictures or take notes or view it again at your convenience. We have many guest presenters today. So get ready. I'd like to introduce to you our first guest presenter. Carlos, put that screen on. No, not yet. His introduction page. There you go. This is our guest presenter, Maurice Held. He is the community educator at Cornell University Cooperative Extension. Please welcome Maurice Held.
Yes, good morning. Thank you, Ms. Sula, for introducing me, and thank you to Ms. Nancy Fernandez for welcoming words. So I also have to thank Mr. Carlos Rosas, who organized the logistics of these sessions. Thank you very much. So here we are presenting this free nutrition health programs run by Cornell University Cooperative Extension. My name, as we said, is Maurice. Okay, I'm a nutrition community educator. Okay, next. Here we are. This is a presentation. You see, I like to put a lot of veggies and stuff. You know, this is very healthy for you. Very good. So next we go. Why do we emphasize nutrition and why do we give nutrition classes? We are not the only one. Why is this? Why also you can choose a career in nutrition? Many organizations have a nutrition program and also hospitals and so on and so forth. So here, you can read here the realities why we are in a stage of a epidemic. Okay, it's very serious. Look at this. The reality: 6 in 10 Americans live with at least one chronic disease: heart disease, stroke, cancer, diabetes. 4 in 10 Americans have two chronic conditions, and 70% of Americans are overweight or obese. And now it's also reaching the youth. Okay, next. Here we are, the American diet. Now, above is a recommendation that should be followed. Below, it's people who are not following the recommendations. Okay, now let's see. Vegetables, you can see everything is in the dark here. People don't eat enough vegetables. No vitamins, no minerals, no fibers. Now, when we go to fruits, it's not too bad, but still people don't eat too much fruit. Now we go to the grains, right? You see here, you see that refined grain is just unbelievably high. You know, people are above recommendation. Why? They love to eat the white bagel, white bread, white whatever. So this is very unhealthy because refined grain becomes starch, starch becomes sugar. For the rest, protein, they have a lot of protein. And a positive here things is about nuts and different other good source of protein. Good. Next, please. Okay, my plate, my wins, make it yours. You everybody knows the my plate. Here we are. So you have the 5 food groups, you know that, the dairy, and the website is Choose My Plate. Next. Okay, now recommendation for a 2000 calorie diet in cups and in ounces. So the message is make half your plate fruits and vegetables. I would say make a lot, eat a lot of veggies and fruits, but mainly veggies. Eat whole grain, forget about refined grain. Have some sun every day to get vitamin D and increase your physical activity. You can dance, you can jump, you can do all kind of stuff, running to school, but increase your physical activity. Next. So here, Carlos, if you can go to the website and very quickly I show people. Yes, click on the website. Thank you. So I advise you to go to USDA website, myplate.gov. Okay, go down. We go down here and we're going to click on vegetables. You see here there are 5 food groups here. We click on vegetables and we go down, scroll down a little bit, and we see what food are the vegetable group. Go down, and here we are. How many vegetables are needed? Now, I want to show you something very important. In the text here, you see in blue, my plate plan. You can go and plan your own diet, the amount of calories. My plate plan. Okay, you put your age, your sex, your height, your weight, and you put the physical activity, and they will give you your own diet. Okay, you can have it also according to the different groups. Thank you. You can close the site now. Thank you, Carlos. Here we're back. Now next. Okay, now we are entering the different programs that Cornell University Cooperative Extensions is offering. The first one, the basic one, you all know it because I've taught that program at the center for years. You know, I'm part of the family. So it's called Eat Smart, Be Active, okay? ESBA. So ESBA mainly will go through the different food groups, the 5 food groups. We also have a lesson. We just had a lesson with the class, Miss Clark class on food safety. Okay, we have another lesson on prepare meals with your children. Okay, so these are different things we do. We always have a recipe. Now we are remote, so it's not as easy. Good. So you can join our free nutrition workshops through Zoom or WhatsApp video calls. So 8 workshops, ESBA. Next. Now this is a program that's done to emphasize the parenting aspect of nutrition. You know that children tend to eat certain foods, especially when they're outside and so on and so forth. So this program, HCHF, okay, Healthy Children, Healthy Family. Many times, like I was teaching kids in Chinatown, and the parents came to me, oh, my child is telling me that we are not eating healthy, okay? We should not bring soda in the house, for example. So children, if they are healthy, they can also make the family healthy and vice versa. So this program has 2 components, okay, the nutrition aspects and the parenting skills. Okay, next. So now the path to success of that same program. So you different elements of we look at drinking water or low-fat milk, eating more vegetables, playing actively, and we look at eating fewer high-fat or high-sugar. Now, very important, limit the TV or computer time, okay, to 2 hours per day. The last one is healthy portions. Try to control the portion we eat on the plate. Okay, next. Keys to success. Very important, the keys to success. So this, I would say, this program has studied a lot of psychology. So they came out with 4 keys. So it means like it's some skills you acquire to help your children to eat better, or yourself. Okay, showing this is the role model, teach by example. Now the second one is supporting. So you encourage, you affirm your child. While you affirm, you respect feelings. You don't force your child to eat. Okay, you don't punish your child when he's not eating certain things. You encourage. All right, now guiding what we can do, not with what we cannot do. What we can do, we emphasize the can do. Divide responsibility. There are responsibilities for children and responsibilities for adults. People don't think that children have responsibilities, but they do. Okay. Now, and we decide together many things, especially when the children are older. Shaping, you shape the environment, you shape first your house, you can shape the school. No soda vending machine in the school, for example. You shape also your neighborhood. A lot of bodegas or other stores are selling food that are not healthy. Good. So next, we still have 4 minutes. Good. So this is the youth program. It's called CHIF. Okay. So it's choose health, food, fun, and fitness. A little too long, but it's nice. Okay. So they emphasize the fitness, the fun, and we also do the cooking with the youth. It's a program that we're going to see now. The detail of the program next. Okay, what we'll do? The following lessons and topics will be covered. So the first lesson, drink low-fat milk and water. Color your plate. This is very nice. You know, you made with a lot of color, the rainbow. Eat more veggies. Of course, fruits, it's easier to eat, it's sugary. Now, the third lesson is very important. Read it before you can eat it. We do that also with adults. Reading labels, reading the ingredient lists. Okay, you can see if there's whole grain. Anyhow, reading labels, reading facts. So you can buy a product, you look at it, and you say, no, I don't want that. It's too much sugar. For example, on the labels now, you have a new line called added sugar. Go, if you take a bottle of soda, 12 ounces, you will see the added sugar is 130%. So it means it's already 30% above the maximum of sugar you should have per day. It's a shame that we give so much sugar in those soda. And people don't drink only one, they drink two or three or four per day, or they buy a large bottle. So you can see now in the new label, you will see the added sugar. Pay attention. You go down the list: fat, okay, carbohydrate, and then sugar, and added sugar. And you will see, it will blow your minds what we are eating today, drinking. Very good. Next, one more at the end. So this is like the newsletter we get for the youth. So you see a lot of activity. So this is the letter about activities, no? Physical activities. And always on the newsletter, when it's available, we put a recipe. Here the recipe is about water with a twist. The first lesson, drink water. The twist is like what I have here, okay? And so I had one. I put some lemon this morning. Every day I have a glass with some. You can put cucumbers. You can put rosemary. You can be all kind of stuff. Have your water with a different flavor. Very good. And we go last but not least. If you want to inquire, take a screenshot of that. You can reach Debbie Clift. The office we have is closed right now in the Bronx, but we'll start again September. We reopen. And then important, you have the website here. In the website, you can also find recipes. Okay, so here we are. Thank you very much for attending the presentation.
Thank you very much, Maurice Held. Thank you. Some of you are familiar with him because you've seen him at Manhattan. So thank you very much. It's so nice to see you again.
Bye-bye.
Enjoy the day. Bye-bye. So our next guest presenter will be Nancy Simmons. She is the public health educator from the Community Health Education and Outreach Department at Harlem Hospital. Please welcome Nancy Simmons. Welcome,
Good morning, everyone. It's so good to be here today. And I'm here to tell you a little bit about Harlem Hospital. If you have never been here, or if you have, just to enlighten you of the services that we offer to our community. Harlem Hospital is committed to improving the health of the village of Harlem and providing cultural, competent, compassionate, quality care to our patients in a safe environment. Our vision is to be the choice of the village of Harlem. We partner with the community to reduce the various health disparities which we see throughout the community and try to expand the access of care and health and to provide patients with a great experience. On the annually, we see approximately 209,575 patients at our clinics, 78,189 patients in the emergency room. We discharge on annually 13,460 patients who have been hospitalized, and we birth close to 1,000 babies yearly, as well as having 303 beds in service ready for use. Our values are to be consistent, accountable, respectable, provide excellent care, and to as well as a safe environment. Next. We have several accomplishments, one of which we are proud of is our Bariatric Center of Excellence. Bariatric Center of Excellence has been approved by the Surgical Review Corporation of the American College of Surgeons as a bariatric surgery center of excellence. We have been designated as a center for Medicaid and Medicare patients. Harlem Hospital is one of the 5 hospitals in New York City that have this designation, and the only HHC facility to have received this CMS designation. The services that we include are surgical procedures to help those who may be who suffer with severe obesity or obesity-related health problems. And this designations tell the world that patients referred to Harlem Hospital will be treated by the most experienced providers and be given the best care and receive the best outcomes from their procedures. We are also proud to be a baby-friendly designated hospital. We were the first ones back in the early 2009, when we have joined with other birthing centers throughout the United States to assist pregnant moms and new mothers in one of the most rewarding experiences of motherhood breastfeeding. We have been recognized as a leader by Baby Friendly USA for declaring our commitment to the principles of the Global Baby Friendly Initiative and establishing high standard possible for protection, promotion, and support of breastfeeding. We are proud to be one of the first hospitals in New York City who have met World Health Organization standard to join this worldwide effort to offer the best possible start for our newborn patients and their families. Next. We are also very proud of our Medina Clinic. The Medina Clinic is the first of its kind in New York City, where it provides comprehensive primary care, health education, and outreach screenings with the cultures and languages of the Islamic community in mind. The Medina Clinic is also open to all people of various cultures, and everyone in the Harlem community is welcome to come to our Medina Clinic to receive first-class culturally sensitive care. In this clinic, there are times, because of culturally related culture, women prefer to be screened by other women opposed to being checked by a male. So we are sensitive to that matter to make sure that everyone receives care in the way they would want to receive it. Our Medina Clinic is a population that typically doesn't reach. Our goal in our Medina Clinic is to reach those who don't come out for medical treatment, and we try to integrate them into the Harlem Hospital's network of services. The Medina Clinic is an extension of the Harlem Hospital's Department of Ambulatory Care, and we provide services throughout the week as well as extended and weekend hours. We are funded through the New York State Health Foundation, the HHC Foundation of New York City, and the Avon Foundation. Being consistent with these foundations' objectives, the project provides services that are needed for the state's vulnerable populations. And the expected outcomes is to establish a replicable clinic model that will provide appropriate healthcare services consistent with the cultural and religious practices of the Harlem Muslim residents. Next. Now, to give you a little information about my department, I'm with the Community Health Education and Outreach Department, and we serve as a link for the community by conducting health screenings, workshops, presentations at health fairs, church programs, tenant and block association meetings, shelters, senior citizen centers, schools, and much more. We offer workshops and presentations around various major health topics such as asthma, hypertension, cholesterol, health and hygiene, as well as diabetes. But we also link with other departments to come out to do presentations, whether it's around fall prevention, HIV services, and any other issues that the community may be wanting information on. We try to make that linkage so that we can provide the best services to our community. Next. Now, some of the programs that we do offer that I would like to talk about is our WIC program. WIC is the Supplementary Food Program for Women, Infant, and Children, which offers services to all pregnant, not postpartum, and breastfeeding moms, their children, and infants up to the age of 5 years old in New York State. As a WIC participant, you will receive monthly WIC checks, which you can use at WIC-approved stores to purchase healthy and nutritious foods. And some of the foods that you can buy with the WIC checks are fruits and vegetables, eggs, iron-fortified cereals, vitamin C fortified juices, dried beans, peas, rice, low-fat milk, baby food, cheese, peanut butter, whole wheat bread, and tuna fish. And I'm quite sure the list grows more and more as we go from day to day. But to qualify for WIC, you must live in New York State. U.S. citizenship is not required. However, you must meet the income guidelines set by the federal government. Next. We also are proud of our Department of Dentistry. We want to restore your smile. Our clinic hours are Monday through Friday from 8 to 5 p.m. If you have an emergency and you cannot book an appointment, you can come in as a walk-in Monday through Friday from 8 a.m. to 2 p.m. The services that we offer in dental are fillings and crowns, root canals, implants, cleaning and whitening of the teeth, dentures, partials if needed. They do oral extractions. They have general anesthesia. They have a comprehensive pediatric clinic for dentistry for children, and they also offer much more. If you ever need a dental appointment, you can call them directly at 212-939-2887. Again, their number is 212-939-2887. Next. We also have a very comprehensive quit smoking program. because we do know there's a lot of people that still smoke, and maybe they're struggling trying to stop, because we know it's not easy to do. But they do have providers to help. They offer counseling, they have group sessions. They also offer nicotine replacement therapies, such as using Nicotrol inhalers. They have the nicotine lozenges, the patch, as well as the gum. So if you know, or if you are interested in trying to stop smoking, you can reach out to our Quit Smoking program, and they too can be contacted directly. Their number is 212-939-8222. Once again, 212-939-8222. Next. So we want people to receive great care right here where you live. It's one place where you can receive all of your health care needs, right in our ambulatory care clinic. The services that we offer are a wide array of services for health care, where if a person needs a medical appointment, if you suffer with asthma and allergies, we have cancer screening, as well as if you want to come to the for women or men who need to come to the breast clinic for screening. We also offer for women mammograms. We have the diabetes clinic, and for those who are patients here, we have a diabetes support group. We have a very good ENT clinic, which is ear, nose, and throat. Our ophthalmology clinic is very comprehensive in giving complete care, whether you have problems with various eye conditions such as glaucoma or cataracts, and they provide excellent services as well as follow-up care. Our family planning clinic is a great place to come for services. And we also, within the family planning clinic, have a men's clinic. For the men, they can come to receive services in terms of counseling. They give out birth control of all types, and also they help families who may be planning to, people who are trying to start a family and are having problems, or if they're trying to spread it out and they need assistance, family planning clinic is there to assist. Our HIV and AIDS program is an excellent program which offers services that offers they offer competent care as well as confidential care to patients who may feel a little out of place of going for services. You can come, and the doctors are there to help you with your services and how to follow up with the proper care that you may need. We also have an excellent mental health services, which also are very competent and provide privacy and confidentiality to the utmost for our patients, because we know there is a lot of stigmatism around mental health, and anyone can have a condition where it may be something that has happened all of a sudden, causing them to have anxiety, or they may have a family or a health history of it. They offer mental health counseling and support as well as medical care. If a person needs to come for surgery for whatever reason, we do offer ambulatory care where you can come in for surgery where you may not have to stay overnight. It may be a one-day procedure that can be that could alleviate the problems that you may be having. You would have to see the medical doctor, and they will refer you further on to who you need to see for this particular type of surgery that is needed. Our OBGYN clinic is excellent for moms who are pregnant and they don't have a place to go for prenatal care. You are welcome to come, and we will follow up after the baby is born. We have a beautiful birthing center where the baby, when it's time for the mom to have the baby stays in the room, is born in the room, stays in the room with the mom before and after birth. And the room is made comfortable for the mom where she can either give birth either in the bed, or they have a huge tub where some women feel more comfortable getting in the water to for the birthing. So we offer that as well. And also we have an excellent podiatry clinic if needed. If anyone is having foot problems, they can always follow up at our podiatry clinic to get foot care. And we have so many more comprehensive services here at the hospital. All you have to do is just come, and we will follow up, and we will provide you with the most comprehensive care that is needed. Next. So our ambulatory care clinic, where you will come for all of these medical clinics, are located in the Ronald H. Brown Ambulatory Care Pavilion. The address is 46 West 137th Street. It's between Malcolm X Boulevard and Fifth Avenue. And if you would like to make an appointment, if you have questions, or if you are a patient here and you run out of medication and you need refills, you can call the following number, 844-692-4692. Once again, that's 844-692-4692. Or if you're still having problems, you can always reach out to me. I'm always here. My name is Nancy Simmons, and my phone number is 212-939-3744. Once again, 212-939-3744. And you can call me directly. I have a voicemail on my phone, so if I miss your call, please leave a message. I will get back to you. So with that, I want to thank you all for being such a great audience, and I hope you enjoy the rest of your day.
Wow.
Have a good one.
Thank you so much, Ms. Simmons. Wonderful information. Thank you. Thank you. I hope you all take advantage of these resources. They're here. Our presenters took time out of their workday to create these PowerPoints, especially for you. So thank you, Ms. Simmons. We'll
Thank
talk
you.
soon. Bye-bye. So our next guest presenter is Henry Orbe. He is the Senior Financial Counselor, and he is the Financial Empowerment and Advocacy Unit at the New York Legal Assistance Group. He's going to give you a lot of information, so please take pictures if you need to, take a screenshot, and welcome Mr. Orbe.
Yes, good morning,
Good morning.
everybody.
Welcome.
Yeah.
Thank you.
Thank you. Thank you for having me and invite me to be part of this virtual community resource event and have the opportunity to talk about a free one-on-one financial counseling. Again, my name is Henry Orbe. If you go to the next, I think, slide on the presentation. Yes. Okay. Yeah, so my name is Henry Orbe. I'm Senior Financial Counselor at NYLA. Go to the next. Today, I will be talking about who we are as an organization, what we will do as a unit, and how you can get connected with a financial counselor to get help. Next. So, about us as an organization. NYLA stands for New York Legal Assistance Group. It was founded in 1990. It's a leading nonprofit organization that provides free legal and financial counselor services to New Yorkers. You can visit our website, nylac.org, to see more information about us, what we would do, how to get involved, and how to get help. Next. Very important, today's presentation is not intended to provide legal advice. In fact, we, the financial counselors at NYLA, we are no attorneys and will not provide legal advice whatsoever. So you need to consult with an attorney. Next. All right. So before I start talking about what we actually do as a financial counselors, I think it would be really helpful to understand the basic concepts about personal finances, so you know what to expect if you make an appointment with us, but also to see if we can help you with whatever financial issue you have. It's very important you get these concepts, and I promise it's going to be the only slides where you can see these concepts terminology. So let's start with personal finances. What is it? Well, it's the study of personal and family resources considered important to achieve financial success. It involves how people spend, how people save, protect, or invest their financial resources. On the first column on the left, you will see financial literacy. Is your knowledge. It's your knowledge of facts, concepts, principles, technological tools that are fundamental to being smart about money, so that it empowers you to handle day-to-day financial matters. Again, probably you heard before, knowledge is power. On the right-hand column, financial well-being, it's a state of being wherein the person can fully meet current and ongoing financial obligations, where you can feel secure in your financial future, and you are able to, important to hear me, is you are able to make choices that allows you to then enjoy life. Again, so to achieve financial well-being, everyone has to be financially responsible. Meaning you are accountable for your future financial well-being, and you strive to make wise, informed, personal financial decisions. In other words, you have control of your destiny. So financial empowerment is not about being rich. It's a process where you can learn money management best practices, so have the right resources on hand, become financially responsible by making the right decisions with your money, and positioning yourself in a path to be financially secure, to overcome unplanned events. Just as you know, we are hopefully at the end of this pandemic, and everyone in one shape and form has been affected financially speaking. So we need to somehow have a plan in place so we prepare for the next one. Unfortunately, we don't know when it's coming, but we need to be ready for the next one. Also, it's important to highlight that our work as financial counselors will be focused on empowering clients to make the right decisions, not on making those decisions for clients. Again, you need to have control of your own destiny. Paycheck to paycheck living can happen to all income levels. It's not about how much you make. It's about how as individuals can manage high control our money. So I do really hope that this slide will make a lot of sense, so you understand how we can really help you. In the next slides, I will talk about how you can get help, how to get contact, and how we can help. We will provide a personalized financial action plan, so you can work on your own plan. Again, every person, every household has different needs to cover. What might be a need for me probably is a want for you, vice versa. So whatever might be your financial goals, we can help you. For instance, I'm going to mention some of those situations where we have helped clients in the past. Credit issues. You have credit issues, score issues. We can help you to fix credit, improve credit, or you don't have credit at all. We can help you to improve that credit. Identity theft. Well, we can help you prevent or resolve issues with related with if you are a victim identity theft. We can talk about debt management, how to deal with collectors, creditors, talking about potential settlements. Although I included a bankruptcy there, again, we don't provide legal advice, but legal referrals is available, again, through our organization or other partnerships. We can help you create a budget, spending plan, so you have control of your money. Also, be able to help you find affordable bank accounts, like how to manage a checking or savings. If your goal is to save or start a savings plan, we can help you find the right tools, affordable tools where you can keep more money on your pocket. Create realistic goals. Again, if you need somehow legal referrals, we might help you to provide that information as well. I personally have some background on taxes. So if you have issues with IRS, New York State, might be able to help you. So going to the next. Again, NYLA, oh, excuse me. NYLA is part of the Financial Empowerment Center Network, sponsored by New York City Department of Consumer and Worker Protection, formerly known as DCA, where participants receive free and confidential one-on-one services. So who is eligible for the program? Well, it's open to any New Yorker 18 years old or older who lives or works in New York City. Again, who lives or works in New York City might benefit of this program, regardless of income, regardless of immigration status. It's free and confidential services. Sessions are held over the phone until further notice. All you need to have is an email, so you can book an appointment, create a portal account, upload documents. Final recommendation: just come prepared for your appointment. When see clients make an appointment and they don't talk about a specific issue, but they don't have the documents in place, and again, just come prepared. And next. All right. So, what to expect on your first session? So before your appointment, you need to create a portal account so you do that so that you can upload statements, documents, notice, whatever might help us understand the issue you have, and provide some demographic information. On your first session, pretty much it's an intake session, about 45 minutes, where consents are signed, demographic and financial information are collected, and we create an action plan with financial goals, whatever it might be. Without this information in place, counselors are not are unable to provide services. So it's very important you come prepared for this first appointment. Follow-up sessions. So for this process to be effective and personalized, clients might need to meet more than once with the same counselor. It's very important. As you might know later, as you may see later, how easy you can book an appointment. It's important you make a follow-up appointment with the same counselor. Otherwise, if you ended up with different counselor or different program, pretty much you need to start over the whole process. So how many sessions? Well, multiple sessions, you can have multiple sessions as needed. Very important, scope of services. Counselors will not provide legal or advice on investments, will not provide monetary funds, will not file taxes, will not apply to government benefits programs on behalf of the clients. If you still need help with any of those things, referrals are available. Again, sometimes most of them are free. And next. All right. So how to make an appointment? Right. Easy. You can call 311 and request financial counseling appointment with NYLA financial counselor. That's simple. So call 311 and tell the operator you need financial counseling. So make sure you select or inform the operator about NYLA financial counselor. Second option is on your screen, you will see the website. So you can go to the website and book an appointment at your convenience. If you can also do like a Google search. If you type by typing DCA Talk Money, and pretty much the first or second link, you will see also the link to get access to book an appointment. Now, once you're on the link, you need to select Financial Empowerment Center under Choose a Program. And you also select your preferred language. You click on Next, and then scroll down till you see NYLA Home Counseling under Choose a Location. Once you do that, then you select the best day or time for this appointment, enter your contact information, name, first name, last name, and email, so that you will complete those steps like the portal, confirm appointment. You can cancel, reschedule appointments at your convenience, and all set. Pretty straightforward to how to get in contact with us to make an appointment. We can go next. Now, if you don't have, you are not interested on financial counseling right now, but you might need you might have some legal questions. Please visit our website, nylac.org, and under Get Help tab, you will see the list of all programs. We have programs and units at NYLA. And when you click on each and the one you are really interested, you will see more detail how to make an appointment or how to request, how to contact that specific unit. Again, that's for legal questions. Talking briefly about what units you might benefit, we have a tenants right, where we can help clients with housing core issues, immigration, so domestic for domestic violence units. Again, it's a list of several programs and units at NYLA. So visit our website to learn more about it. And we can go to next. All right, so financial empowerment can be within your reach, no matter your income. That's because the beginning steps don't start with dollars or with money. The beginning steps start with a mindset shift. So let's work together to achieve financial well-being for you and your loved ones. So you have questions, on the screen is my email. So feel free to contact me if you have questions and you have issues booking an appointment with a financial counselor. Shoot me an email. Also on the subject, you can mention this event so I know where you're coming from. It's pretty straightforward. Call 311 or go to the website and book an appointment. It's free, confidential, one-on-one financial counseling services. With that, I want to thank Sula for the invitation, and then I get back to you. Thank you. Thank you, everyone. Have a nice day.
Thank you so much, Mr. Odobe. This is so helpful for all of us to know how to empower ourselves financially. We have a lot of the staff using the services, and it's been such a help for everyone. So, ladies and gentlemen out there, take advantage. Free, free, free. Free, free, free.
And
Thank
confidential.
you. And confidential. Very important. Muchas gracias, señor. Thank you. Enjoy your day.
You too. Thank you.
Bye now. So everyone, you should be taking pictures. You should be taking notes, or just know that you can view this again at your convenience by using the same link. I hope that you are taking pictures. I hope that you are also, what I meant to say is put your name in the attendance box with your teacher's name. This way we give you credit for your attendance. Okay, thank you so much. That was wonderful. Wonderful. We have some great guest presenters, and they took the time out of their workday to create these PowerPoints for you because they know how important resources and services are to our community. So thank you. Okay, our next presenter. Our next presenter, some of you already know because he's been to a school and he's been a member of the MMALC family for years. I know it's over like 13 years, but he'll give you the exact number because he keeps track of things like that. It's David Perez. He's the executive director. He was promoted to executive director of the Harlem Center for Education. Welcome, David Perez.
Good morning. Good morning, Ms. Haskell. Thank you so much. And Carlos, Mr. Rosas, for putting this together and inviting me. Good morning, students. Again, this is a great opportunity to be with you. We're a little bit pressed for time, so I'm going to jump right into it.
All right, go for it.
Carlos, thank you very much. Fantastic. So our organization, the Harlem Center for Education, what we do is we help adults who are interested in pursuing post-secondary education after they finish with their high school equivalency, or we also work with individuals that are English language learners and are looking to pursue college after they increase their proficiency in English. So what we do is we provide you with free services, with college application assistance. We help you with applying for financial aid. We do career counseling. We do academic advising. Everything is free. We're funded by the U.S. Department of Education. We don't work for any specific college. So I think that's an advantage for you in that, we can give you impartial advice on, what we think in our professional opinion is the best course of action for you. We have no attachment to any college. I do talk a lot about CUNY, and you'll see why. But I just think that that's a good option, for adult learners in terms of all the different programs that they offer and its affordability. So that's just a little bit. Oh, and also most importantly, we're in the neighborhood. So we are located on 104th Street and 5th Avenue. If you know el Museo del Barrio, we're in that same building. It's right across the street from Central Park. On nice days, I usually walk to Manhattan. It's about a mile away. To the north and to the west. So we're in the neighborhood and we hope to see you in the fall. But as of right now, we're doing everything via remote in terms of our services. All right, so we can go to the next slide. Okay, so what is going on in terms of the job market? We see that the job market continues to be difficult because obviously we know that we're in a global pandemic, which the United States was the epicenter for over a year, and things now are getting a little bit better, but we still have, kind of that drag on the economy because so many things closed down and so many things had to have limited capacity. And so that is something that we continue to see, even though things are starting to open up and get a little bit better. We did see something like this in like 2008, 2009, 2010, when there were big issues with the economy that were structural. And you saw a lot of people, what they did during that time, because they couldn't go and find work, they went back to school. The idea being that when you go to school, you pick up a skill, you pick up a credential, a certificate, a license, a degree, that when you go back to the workforce, you have something that you can, make yourself marketable with. And I think CUNY is a great option for us adult learners, specifically when you talk about community colleges. There's 7 community colleges. You have Queensborough Community College, Kingsborough Community College, Bronx Community College, LaGuardia. You have BMCC, you have Gutman Community College. So you have all these community colleges. And the great thing about them is that they're open admissions. What that means is that any student that goes in with a high school diploma or its equivalency and the $65 application fee, you're going to be accepted. And so that means you don't have to take SATs, you don't need regents, you don't need recommendation letters, you don't need interviews, any of this kind of stuff that you would need for a 4-year college. So that is very useful. Again, very flexible, and there's remote learning options as well. We can go to the next slide. Okay, so here I have just some resources, and obviously we don't have the time to get into them in depth, but the first one is the link of all the CUNY academic programs. And so what this does is it gives you information on all the different academic programs that CUNY has. And there's about 1,750 programs. I think it used to be 1,600. Now they just increased it. And there's everything. And so one of the things that I use this in our counseling with adults is you use that first link in conjunction with the next 2, with the Occupational Outlook Handbook and the New York City Employment Projections. The next 2 links give you information about the job market. And I think this is very important for adult learners because we're going into college in a different way than the traditional college student. The traditional college student, the 18 to 22-year-old, have a little bit more time to explore and things like that. And for us adult learners, I want us to already go in there with some kind of idea what we want to do. And so that takes a little bit of research. And so you combine these 3 resources together and in terms of also looking at what you like, and then you kind of create a plan. And my whole thing is don't necessarily start off with a 4-year bachelor's degree or a master's degree. It may benefit you to get a certificate first, get an associate's degree first, and then you can use those to get a job and then continue to build on that. And so I think that is very, very important when we talk about building a career plan. There are programs that are certificates, like substance abuse counseling. That's a certificate. That's a 1-year program. But you can take the credits from that program and then roll it over into, let's say, your associate's degree. Your associate's degree is 60 credits. And so if you do a 1-year program, you already have 30 credits. You have half of it done. You use that certificate and you can use that for employment, be able to go get a job, and then continue to advance in your career. So we're looking at school in a very career-focused way. One of the things that I always emphasize to adult learners is that you don't have to go full-time. In fact, what we recommend to adult learners is to go part-time. 2 classes a semester, 3 classes a semester. But what you do is, instead of just going during the fall and the spring, you also go during the summer. And so that means that you have 4 opportunities to gain those credits so that you can be going part-time. But if you include the summer, it's also going to equal to the same amount of time in terms of credits that a person that's going full-time is going. And so these are the kind of strategies that, we sit down and we map out with you. Nobody is going to be expecting that you drop everything that you have going on in terms of your family and job responsibilities and things like that just to go to school. I want to emphasize that we're going to be doing this on a part-time basis, and so it is at a level that you can manage in terms of your time management. So I just want to make that clear. But again, these are good resources that you can use as you review the presentation here when at your leisure. Check out these links. There's a ton of good information here. Okay, we can move to the next slide, Mr. Rosas. Okay, so how are you gonna pay for school? There's something called financial aid. So there's something called the free application for federal student aid. That's called the FAFSA. What this does is it allows individuals who are, low income is not necessarily the right word, because you don't need to be low income in order to get financial aid. You just have to have financial need. And the way that they calculate that is obviously looking at your income, but they're also looking at your family situation. They're also looking at the cost of the school. And so the reason I kind of put those other things in there is that you don't want to assume that you don't qualify. You always want to apply. It's free to apply. Notice it says free application for federal student aid. And we sit down with you and we help you do this. We help you fill out the forms. It's all online now. You take your income information from the previous year, and you see there that you can get up to a maximum of $6,345 per year. This is up until you complete your bachelor's degree. And if you look at the tuition at CUNY, the tuition is $4,800 a year, which means that if you get the maximum financial aid, you will have enough money to pay for your tuition and also have money left over for books and transportation and, kind of incidental expenses that come up. This is the way I went to school. Okay, I went to school using Pell Grants, and the other one, which is called TAP, which is a New York State Tuition Assistance Program. That's up to $5,165 per year. Again, I want to emphasize, these are grants. These are not loans, okay? You will know if you're taking out a student loan. You have to sign about 10 different documents. Now it's e-sign. It's all online now. But you have to sign a number of documents acknowledging that you are taking out a loan. So this is not a loan. This is assistance that is based on financial need. You do not have to pay it back. This is the way I went to school. Okay. We can move on, Mr. Rosas. Thank you. Very good. Okay. Who is eligible? So first one is you have to have your task. And so we want to make sure that, you complete your task. Now, the good thing about the task, as opposed to the OGED, is that it really is giving you that college level of preparation. The work that you're doing now is really focused on, helping you get to the next level. Now, why is that? Because that's the point of the high school equivalency. When the GED program started, it started after World War II. Why? So that, the returning soldiers, that went off to war in World War II, they had a way to get a high school diploma so that they could take advantage of something that was called the GI Bill. The GI Bill paid for their college. And so now, you can't go to college without a high school diploma. So it's always been thought of as a way for you to get a ticket, an entry point into further education. That's where you're going to get the financial benefit of a high school equivalency diploma. And the reason I'm saying that is because they've done a lot of research around this, and they have consistently found that the linkage between you making money from a high school equivalency and you not making money from a high school equivalency is if you use that credential to go to college or some kind of training, apprenticeship, license, something. And so I want to emphasize that to you. When you get that task, do something with it. Individuals with financial need, we talked about. For you to get federal financial aid, you have to have U.S. citizenship or have one of these other statuses that I have there next to asterisk: permanent resident, refugee, political asylum. But, and this is new, for New York State, you do not need this anymore. As long there's something called the Jose Peralta Dream Act now. And as long as you have a high school equivalency from New York State, and within 5 years after you get the high school equivalency, you go to college, you're able to get financial aid regardless of immigration status. This is for New York State financial aid. So this is a fantastic program, because before it used to be the case, you used to have to pay out of pocket just by yourself if you did not have documentation. So this really helps us out. You have to be working toward a degree or certificate. So we're going to do a program. You can't be in default on a student loan. Again, we're going to use our grants. We're not going to focus on loans. And you have to maintain satisfactory academic progress, which means you have to pass your classes. Okay, so again, these are just the basics of who is eligible for financial aid. Okay, we can move to the next slide, Mr. Rosas. Oh, good. Okay, and if you hit it again, I think my information should come up. Yes, there you go. Thank you so much. So as I wrap up here, we will help you with all of this process, okay? The problem with adult learners going to college is not the academics. We're fully confident that you can do the academics. And in fact, there's research that says adult learners do actually better than traditional students in college, because you're not partying, you're not going to the frat house, you're not pledging fraternity, sorority, etc. You're there focused on your academics, okay? But what you may have a problem with is the process, you know, submitting documents. What office do you go to? Who do you call? Who do you ask information from? And so we will help you with this. So when you're done with your task, you can contact Mr. Ruffin, or you can contact everybody in Manhattan. Everybody in Manhattan has my information, okay? And so we will help you with this process. We have seen situations where, you know, we have individuals that have issues with the financial aid office. And so, you know, this is something that we want you to remember. When you go to a college, it's a lot of what you call bureaucracy, okay? Which means that there's a lot of paperwork, there's a lot of process, there's a lot of different things that you need to do. And so we need to make sure that you are able to navigate that process successfully. And so what we want to do is we want to have you well prepared, so that when you go into the college, you already have an idea of what you want to do. You know, what are some majors? You know, New York City has a lot of different career options that you can take advantage of, you know, that are in demand. Technology, education, social services. Maybe you want to do a trade. Maybe you want to do, you know, healthcare. And so you have these type of programs like dental hygiene, or radiologic technology, or all these different kind of programs that you can do at a community college. And because you may qualify for full financial aid, you can go, I don't like to say free, but with no out-of-pocket expenses. And so, because when I went to college, I had financial aid and I didn't have to pay anything out of pocket. And so we want to make sure that you know, you're in the situation where you don't have to take out student loans and all these different type of things, and make sure that you are you know, taken care of in terms of the process. So everything that we do is free. Right now we're doing everything over Zoom, and I'll give you just some examples of some students that, you know, we've helped out with different steps of the process when it comes to applying for what's called a dependency override. So some students are like 21, but they still, you know, in that situation, you still need to provide your parents information for applying for financial aid. And so what we do is we sit down and we talk with the college financial aid office to let them know that this is the situation, this is what's happening. And we help you kind of gather all that documentation, you know, to make sure that everything is on the up and up. CUNY, their application process is you know, can be a little bit tricky with regard to you know, the different steps that you need to take. And so, because now you have to open up a CUNY First account, and you have to do a number of different kind of, you know, what we call dance steps in this business. And so what we want to make sure is that you are able to navigate those. And so we definitely focus a lot on the shorter term programs, certificates, associate's degrees, because again, the main point is you want to make sure that you get a credential, a piece of paper, a credential that says that you know something. That is very important to employers, because what they want to see is that you have completed an area and that you have, some level of expertise in that field. And so it doesn't necessarily mean that you have to run off and get a master's degree. You can use something as simple as a certificate to get you started in a field. So as we said before, you want to start off at the most basic level. Use that to get a job, and then build up, and continue until you get to your long-term goal. And so that is something that we always want to emphasize with adult learners. You don't have to be intimidated about college. I think the two most important things about college that you can focus on are your time management and your study skills. These are things that we can work on, and there's strategies for you in order for you to be successful. There's study groups. The professors have office hours. And so, for adults, we just want to kind of, realize that college, may be the scary thing that that it's something over there that's not for us. It's, not for adults, but that's no longer the case. Because the fact is, you need some level of education and training after your task. And there's all these resources. We're just one, and it doesn't necessarily have to be college. This is what my organization focuses on, but you can do an apprenticeship, you can do a license, you can do, a vocational certificate. Our whole point is that when you finish with your task, you need to make sure that you continue to develop your skills. And so we want to make sure that you're able to do that the right way. There are a lot of organizations, there are a lot of colleges that, will promise you jobs, will promise you, you go to school for free, and you come to find out they don't have the right accreditation, they don't have the right, licensure or anything like that for you to get, an actual job when it comes to when after you finish the degree. And so that's one of the reasons that we talk a lot about CUNY. CUNY, as I said, the City University of New York, there is it has a long-standing tradition. It's been around for over 150 years, you will have a credential that will be recognized everywhere. Same thing if you go to SUNY, which is the State University of New York. Now, for most adult learners, SUNY is a little bit different because most of those schools are upstate, they're residential. But SUNY Empire State College is actually a really good option for adult learners. They have a lot of programs that are focused on adult learners, a lot of online learning, and things like that, to help you kind of finish quickly. And so all these are resources that are here for you, just like Mid-Manhattan is a resource. We want to continue to extend that so that, you are able to kind of take advantage of these things. And the other thing I want to say with financial aid, and I should have mentioned this before on that slide, is that anybody that's receiving any type of federally means tested public assistance, SNAP, WIC, free or reduced lunch for their kids, public assistance, Medicaid, you automatically get full financial aid. And so we want to just demystify this process. We want to do this with you. We're here. Here's our contact information. Everybody in Manhattan has our contact information. And so we definitely want to, here it is. Here's our website. We definitely want to sit through this process with you so that you have, the right resources and support. So thank you for listening. And I'll toss it back to Sula.
Thank you, David Perez. Such important information. Amazing. So, David, tell everyone how long we've been together. We've been working together.
13 years.
13
years, going on 14. So so we're family.
Yes, absolutely. Thank you so much for imparting all this good information. Students take advantage, soup to nuts. They hold your hand, they take you through the process, they empower you. So get going after your task, get going, give them a call. Thanks, David. We'll
Thank
talk
you so
soon.
much. All right.
Thank
Bye-bye.
you. Good information, huh? So our next guest presenter. Don't forget, sign in. First name, last name, teacher's name for your attendance. So our next guest presenter is Emma Myers. She is the program manager of the RIF, the RIF Asylum Support. So please welcome Miss Emma Myers. Welcome, Emma. You need to unmute yourself.
Of course.
There you go.
We've been doing this for a year, and it's like I get worse at this each consecutive day. I forget to unmute myself. Thank you so much for having us. Thank you, Sula, for inviting me. We're really excited to share about what we do. My name is Emma. I am the program manager at RIF Asylum Support. We are we're a tiny nonprofit based here in New York City that provides orientation services for asylum seekers. I'm going to talk a bit about kind of the asylum context here in New York, and then I'll go through the services we offer specifically and how you can connect with those services if you're interested. If I could ask Carlos for the next slide. We were founded in 2007 to fill a gap in kind of orientation services for asylum seekers. People often use the term asylum and refugee interchangeably, so I want to pause for a second to kind of tease out these definitions. Asylum in the United States is a very narrow legal status that you need to apply for and then kind of receive. And you apply for asylum by documenting that you were persecuted in your country of origin because of your political beliefs, your religious beliefs, or your belonging to a certain social group. You were persecuted either by the government or by a non-state actor. And in the case of a non-state actor, you also have to demonstrate that the government in your country of origin was unwilling or unable to protect you from the persecution you experienced by the non-state actor. So it's a very specific kind of legal status. The other feature of asylum is that you need to apply from the United States. So you need to have arrived at a port of entry or have entered the country before you can begin the process of applying for asylum. By contrast, and I won't get into kind of the legally what qualifies someone to be a refugee, but the key difference to think about with refugees is that that's a status that you're going to apply for and receive when you're somewhere outside of the United States. You'll receive refugee status and then you'll come to the United States. And when you do, there are these organizations called refugee resettlement agencies. And they are essentially kind of your first stop. They're like a reception center, a welcome center, and they're going to kind of walk you through getting situated, for example, in New York City, finding housing, getting an ID, stuff like that, finding a job. That doesn't exist for asylum seekers. And so that was the gap that RIF was founded to fill. And it's exacerbated by the fact, especially in the New York context, that asylum seekers often arrive through the airport and they often arrive by themselves. So they get here, and not only is there no equivalent of a refugee resettlement agency for asylum seekers, but they're not coming with family members necessarily in the way someone who gets refugee status outside of the country might. They're often coming by themselves and really left to their own devices to figure out how to apply for asylum and how to navigate this difficult legal process. The last thing I'll say, kind of in reference to kind of our history as an organization, is that when we were founded, it was really before asylum had the attention that it does in the media today. And especially asylum seekers in New York were kind of this invisible group that people didn't really know a lot about. So yeah, that's what I'll say on that. Carlos, if I could ask you to shift to the next slide, please. Initially, we were focused on legal orientation services for affirmative asylum seekers. And I'll get into what an affirmative asylum seeker is. But since then, we've expanded to provide education and career services as well. So those are the services I'll talk about in a moment. Carlos, could I ask you for the next slide, please? So who do we serve? We serve primarily affirmative asylum seekers. That's someone who's, you don't have to submit an application yet. Maybe you're just considering whether asylum is something that you want to apply for. So it's someone considering applying for asylum. It's people who have submitted their application and are going through the process. It's a very lengthy process. Depending on when you applied, I mean, for some people, it's a process that takes 6-7 years. And asylees, those are people who've been granted asylum. So if any of this applies, you're our audience. And then, as I said, we work primarily with affirmative asylum seekers. There are two kind of ways to apply for asylum in the United States. Either you arrive at a port of entry, like say at JFK, you have a visa to enter the United States, you enter the country, and then once you're inside of the country and you've gone through customs and everything, you will submit an asylum application to a local asylum office. And those asylum offices are run by U.S. Customs and Immigration Services, which fall under the jurisdiction of the Department of Homeland Security. The other process to apply for asylum is the defensive process. And that means you arrive at a port of entry. It's less common in the New York case because you can't really get on a plane to get to JFK unless you show you have a visa. So we're really talking about the southern border when we talk about the defensive process. You arrive at a port of entry and you don't have permission to enter the country. And so at that port of entry, you say that you're seeking asylum. And your case then follows a slightly different process where it goes automatically to immigration court. Immigration court falls under the jurisdiction of the Department of Justice. People who go through the defensive process are often detained for a period of time while they wait to kind of have their credible fear interview, which is saying, essentially an asylum officer is going to determine, okay, based on what this person is saying, it seems like they have a reasonable asylum case. And so we'll start an asylum application with them. We work, because of the nature of who's arriving in New York City, we work primarily with affirmative asylum seekers. And New York City is has one of the highest concentrations of affirmative asylum seekers. Under the Trump administration, USCIS, U.S. Customs and Immigration Services, stopped releasing data on the number of affirmative asylum seekers. So this information is a little outdated. But the last data from, I want to say 2018 that was available shows there are about 360,000 affirmative asylum seekers in the country. About 80,000 of them are in the New York area, are being served by the two asylum offices here in Newark and in Bethpage on Long Island. So that's the population we're working with. Carlos, if I could ask for the next slide. Thank you. So I'm going to get a bit into kind of what we offer, what our programs are. Our bread and butter is our legal orientation program. We have several components of services within that. The first are kind of general consultations that are generally for new applicants. It doesn't mean you're newly arrived in the US. It could just mean you're beginning to consider whether asylum is something you can and want to apply to or for. So those are kind of our general consultations. But we also have some more targeted legal support in response to a range of factors that I'll kind of run through quickly. The first is that it's incredibly difficult to get a pro bono, meaning a free attorney here in New York City. There are a lot of people looking for pro bono immigration attorneys and too few people providing that service. And it's a very selective process. In order to get a pro bono attorney, immigration attorney here, you need to already have a pretty well-written application in order to be considered. And if you don't get a pro bono attorney, then you're looking at paying kind of significant sum for a private immigration attorney. And there are a lot of really amazing private immigration attorneys in this city. And then there are a lot of kind of what we call factory attorneys who are just, they're making that money and they're churning out applications, and they're not necessarily working very closely with you as their client to make sure that that application sets you up for success. So that's one of the first factors in kind of our more targeted legal services, is that it's difficult to get an attorney. The second is that we heard a lot about this in the news over the last few years. The Trump administration's implemented a series of kind of anti-asylum policies that have made it very difficult to go through the asylum application process without an attorney helping you. There are all these tiny things that if you do it wrong, it disqualifies you and stuff like that. So you really need an expert helping you. The Biden administration, it was awesome to see their immigration proposal on day one. It's clear that they're taking on some of this. They're taking on kind of rolling back some of these really deleterious policies of the Trump administration, but it's going to be a slow process. It takes a lot of time. So we're looking at kind of a slow rollback. And then on the Trump administration's policies. And then finally, we've seen a growth in the backlog of asylum cases, which predates the Trump administration. It's actually due to not having enough resources to deal with asylum cases in U.S. Customs and Immigration Services. And so for people who applied between 2016 and 2018, they're especially stuck in this long, in this kind of long waiting period of many years to get their asylum interview. And so there's a lot of support we provide to people who are in that situation. So kind of diving into some of our more specific legal orientation services, we do asylum application review for people who are going through the process pro se, which means that they don't have an attorney helping them. It's to make sure that they submit that asylum application correctly so that it's accepted by USIS and their case can be in. We provide ongoing support after someone submits an asylum application, and this can be strategies to find an attorney. It can be collecting evidence to strengthen the case. Once you arrive in the United States, you have 1 year from your date of entry to apply for asylum, unless you meet these criteria for an exception to that 1-year deadline. And so often people have to submit their applications before they can get all the evidence that's available to back up their application from their home country. And so we often work with people after they've submitted over a course of months and years to collect all of that evidence to really strengthen their case. Once people are called for an interview, especially pro se candidates or applicants who are going through the process by themselves, we provide asylum interview preparation. And then the final one to mention is that we provide work permit application assistance for asylum seekers. This is especially important because one of the last kind of regulations that the Trump administration put in place made it very difficult and made it take forever to apply for a work permit if you're an asylum seeker. And the regulation was quickly sued by a group of nonprofit organizations. And the judge hearing the suit stopped the implementation of the rule. They provided some injunctive relief, which is great because it means asylum seekers, are following the previous regulation. It's easier for them to apply. But getting this injunctive protection is it's difficult. It's a kind of difficult process. It's a little bit, it's not so intuitive. And so we've been working a lot recently with helping asylum seekers navigate that lawsuit and how to make sure that the protection that the judge has afforded to asylum seekers applies to their application. If I could ask you, Carlos, for the next slide, please. We have a range of other services as well, which we've really developed in response to the growing backlog in asylum cases. So for people who, you submitted your application in 2016, 2017, you're still waiting for your interview, you're kind of in this legal limbo. These programs are designed to kind of help you take advantage of that time as much as possible. The first kind of largest component is our Education Pathways program, and it ties into our kind of one-on-one career coaching. Through our education program, our education advisor provides one-on-one consultations to help you think about what higher education program might be the best fit for you, whether kind of getting an undergraduate or a graduate degree is the right move, or doing some of these intensive skills building programs, especially kind of in tech and in the healthcare industry, or some of these kind of licensing. Our education advisor also helps navigate degree certification. So if you have degrees from back home, there's the process you have to go through for it to be kind of recognized as a degree here in the United States as well. So we help guide on that. And then we have a range of kind of professional kind of coaches and mentors in different fields who can advise on kind of the job search process. And it's both. What we hear most often from kind of members of our community is that their challenges in accessing jobs or to kind of professional positions commensurate with the experience they bring from back home are twofold. The first is a kind of cross-cultural difference in job searching and how to do it effectively. And the other is a lack of a professional network for people who may have extensive careers in a field, but their whole network is back home and they're kind of restarting the process of building a professional network here. So that's what our professional kind of career coaches focus on. At the beginning of the pandemic last spring, we started a weekly support group that meets on Zoom for asylum seekers to kind of have a space with, where they could talk to other asylum seekers about the way the pandemic and their asylum seeking status were exacerbating each other and just generally, kind of getting through the difficulty of this past year. That's open to anyone who's an asylum seeker or an asylee. I will talk a bit about how to connect with us. So if that's something that interests you, we'll talk about that on the next slide. And then finally, recently, we're kind of launching an advocacy campaign to take advantage of this opening that the new administration provides to think about how to reduce the backlog in affirmative asylum cases. We have a series of kind of policy proposals at the DHS level, agency level decisions that could ameliorate the kind of long waiting period some asylum seekers are facing right now. Carlos, if I could ask you for the final slide. So that's, thank you. That's a bit about us, a bit about asylum in New York. How to connect with us, please check out our website. In particular, watch out for our asylum alerts. This is where we post kind of information about changes to asylum policy, as well as kind of things that are relevant to undocumented immigrant populations here in New York City, which asylum seekers in some ways fit into. So for example, we're kind of watching New York State's new relief program for undocumented immigrants and kind of providing updates on that. Follow us on social media. We have Facebook, Instagram, and Twitter. Our handle on all three is at @reef_NYC. And then finally, every Wednesday at noon, we have what I think of as kind of office hours, or just a time when our resource team we're on Zoom Wednesdays at noon, and you can just drop in. The direct link to join that meeting is on the homepage of our website. And if you have any questions about asylum, want to participate in any of these services, it's a chance for us to meet you and think about kind of what the best fit is and next steps to engage you in some of our programming. So with that, thank you so much to all who are watching. I'll pass it back over to Sula.
Thank you so much, Emma. Valuable information. This was chock full of information. You did great. And I'm sure our students are going to be taking their texts, their screenshots, their pictures, viewing this again for all this information you provided. Thank you so much.
You're very welcome.
Enjoy the rest of your day.
Thank you. You too.
Thank you. A lot of information, right? important information. So you're going to have to view this again because good stuff here for you. Our next presenter. Okay. Our next guest presenter is Asmahan Malo. She's the neighborhood organizer from the New York City's Mayor's Office of Immigrant Affairs. Some of you might have seen her on a previous podcast that we had for our students. So come on in, Asmahan. Welcome, welcome.
Hi, good morning.
Good morning. Thank you for being here and joining
Of
us
course.
and giving the information to our population and our community. I'll let you continue and I'll see you at the end.
Okay, perfect.
Thank you.
Bye, Sula. Hi, good morning, everybody. As Sula mentioned, my name is Asmahan Malo. I'm a neighborhood organizer with the New York City Mayor's Office of Immigrant Affairs. For some of you who are not familiar with our office, we're one of many mayoral offices. And what we do in particular is we focus on the needs of immigrant New Yorkers, and we advocate for them no matter what their immigration status is. But more importantly, in my role, I connect immigrant New Yorkers with critical city resources and programming, which is what I will be going over today, with a focus on sort of COVID resources, obviously because we're in a difficult time during this COVID pandemic. So I will be going over those resources. So Carlos, whenever you're ready, we can go to the next slide. So yeah, we're gonna start off with what makes sense, which is health resources, right? We're still in the middle of this pandemic. And right now, you know, a year later, we have vaccines. So what is really important for everybody on this call and on this part of this resource fair is to know how to access vaccines and who's eligible. So right now in New York City, all New Yorkers 16 and older are eligible for the COVID vaccine. These are free vaccines. It does not matter what your immigration status is. And all you need to get a vaccine is an ID. And depending on where you're going, an appointment. The good news right now is that city-run sites, so any vaccination site that is run by the City of New York offers walk-up, so you can actually show up with no appointment and get vaccinated. But if you want to make an appointment, or you want to go to another site, or you want to see something more convenient to where you live, you can go online at vaccinefinder.nyc.gov. And it'll show you all of the vaccination sites near your home, or wherever it is that you'd like to get vaccinated. And it'll also let you know what vaccinations are available at that site. So if it's Moderna, Johnson & Johnson, or Pfizer. And if it's easier for you to call and you'd also like access to multiple languages, you can call 877-VAX4NYC, and that number is 877-829-4692. And you can call and you can ask for whatever language you would like to speak to someone in, and they can help you make an appointment. And the important thing again is that these vaccinations are free, and it does not matter your immigration status. And so we want to make sure that folks understand that if people are telling you that you have to put money down or ask you for credit card information for a vaccine, that this person is scamming. And so do not fall victim to those scams, and just keep in the back of your mind that vaccines should always be free, and no financial information should ever be asked of you. And so we can go to the next slide. And COVID testing is still incredibly important. I know that right now everybody's really focused on vaccinations, but we still want to remind New Yorkers how critical it is to get tested regularly, even if you've been vaccinated. We want to make sure that you know your health status, and that if you know your health status and you can keep yourself and others safe and in good health, so please get regularly tested, especially given the unpredictability of this virus. And it's really easy. So right now there are over 200 community sites, which have shorter lines than, you know, the private testing sites like CareCube or CityMD. And you can go to nyc.gov/COVID tests, and it'll show you a map of all of these community sites. So I pulled up Mid-Manhattan Adult Learning Center, and it showed me the Gotham Health, which is a health hospital, and you can go and get tested there. And then obviously, if you get tested and you test positive, you know, follow the usual protocol, which is to separate from others. I try to quarantine, and you will get a call from a contact tracer if you test positive, and I'll talk a little bit more about contact tracers in the next slide. So if you've heard of contact tracers and are not sure who they are folks who are working to minimize the spread of COVID-19. So when someone tests positive, they make sure to check on that person and also check on others that they have been exposed to. And so the success of the contact tracers really depends on all of us participating. So if you get a call from a 212-540 number or a 212-242 number, please take that call. It is a contact tracer. And what they'll do is they'll, depending on if you've tested positive or were exposed to the virus, they will let you know. They'll check on you if you've tested positive. They'll ask if you need services. I know a lot of us don't really know what to do regarding quarantine, how to access services if you can't leave your house and things like that. And that's what what their job is to really help you navigating quarantining and what it means when you're positive, you test positive for COVID. So they'll provide services. They'll never ask you for financial information. These calls are confidential and private. If you get a call and someone says they're a contact tracer and they ask you for any financial information or your social security number, please hang up that call immediately because that is not a contact tracer. And we'll talk a little bit more about what kind of services they offer as well. So we can go to the next slide. So for example, if you get a call from a contact tracer and you let them know, for example, hey, I tested positive for COVID. I live in a small house. I can't safely quarantine in my home. One of these services they'll connect you with is our hotel accommodations. And this is a free service available to any New Yorker who contracts COVID-19 or is in contact with someone who is tested positive. So let's say someone in your house tests positive and you can't distance yourself. You can be put up in one of the COVID-19 hotels. And it's free and you stay there for the whole quarantine period, which is 14 days. And you don't need insurance. Your immigration status does not matter. So if you would like to request a hotel room and you haven't gotten connected to a contact tracer, you can call 212-COVID-19, which numerically is 212-268-4319. And then to learn more about what other accommodations are provided through Test and Trace and through the hotel, you can go to www.nychealthandhospitals.org/testandtrace. And if you want to learn more about the hotel accommodations and other things that you will receive, you can go to, after Test and Trace, you can put /take care, and that'll let you know what services are available. And we can go to the next slide. And so aside from those health resources, we really want to make sure that folks have access to healthcare at this time. During a health pandemic, we cannot afford to go without health insurance and access to care. So if you right now are uninsured or you're not enrolled in a health insurance plan or just any healthcare program, you can get connected to Get Covered NYC, which is a free service offered by the city where you will work with a healthcare specialist in any language that you speak to get you connected to a healthcare that is affordable to you and that you're eligible for. And a really great thing about Get Covered NYC is they'll also connect you to health services if you don't qualify for private or public health insurance. because one of the health programs that we have here in New York City is NYC Care, which you've probably heard of. And it is a healthcare program that is free and available to anyone, regardless of their immigration status, as long as they qualify, meaning they don't qualify for public or private insurance. So regardless, if you are not in a healthcare plan right now, please text covered NYC to 877-877, and a health specialist will help you get free enrollment into the program and insurance that best suits you. We can go to the next slide. In addition to all the other health resources I mentioned, mental health is incredibly critical during this time. We want to make sure that just like your physical health, your mental health is in tip-top shape. This is a very difficult time. A lot of us have lost loved ones, or we're in really stressful situations, working from home, or having children at the house. So if you or anyone you know would like to speak with a counselor, Connect with NYC Well is a free program. It's offered 24 hours a day, and the trained counselors speak over 200 languages. And so NYC Well provides crisis counseling, peer support, short-term counseling, and they can also connect you to ongoing mental health or substance misuse services. And so there's really 3 great ways to get connected to NYC Well. If calling is easiest for you, you can call 1-888-692-9355, or shorter way to know that is 1-88-NYC Well. You can text with them by texting WELL to 65173, or you can chat with them online with a computer by going to nyc.gov/NYCWell. And we can go to the next slide. And so right now, another obviously important thing is making sure, I'm saying this all the time, an important thing, but being connected to all the resources you need. So if you qualify for public benefits or you need public benefits, the process is a lot easier now. You can download the Access HRA app by visiting nyc.gov/accesshra, and you can fill out the application and go through the whole process through your phone or through the computer. And we really want to encourage people who really need assistance right now to apply for public benefits. One of the things that we know about immigrant families is a lot of them are undocumented, so they don't think they qualify for public benefits. But if you are in a mixed status family, for example, you may be eligible for public benefits. So, for example, if you have a child that is a permanent resident or a citizen, you can apply for public benefits on behalf of them. So please take advantage of the easiness of this process and apply. And obviously they will let you know whether or not you qualify, but it's better to apply, especially if you are in need of assistance with food, cash assistance. If you need the one-shot deal, which helps you stay in your home. We just want to make sure that you have the resources you need. So we can go to the next slide. Aside from that, other resources that are available, for example, if you're facing food insecurity, is we have our Get Food NYC program, which offers free meals to students and children and adults Monday through Friday at New York City DOE sites. And so you can find a location by going to nyc.gov/getfood. I'm going to let you know the closest meal hub near your home. And this is available regardless of immigration status. You don't need to show identification to get a meal. You just have to go to the site and grab the 3 meals that they offer. And so yeah, again, so the site is nyc.gov/getfood. If it's easier to call or text, you can text food to 877-877, or call 311 and say get food, and they'll connect you to the nearest location. We also offer this service through delivery as well if you are unable to leave your home. And you can get connected and enroll for the delivery service at nyc.gov/getfood. And we can go to the next slide. Another service I really want to quickly mention, I know we're getting short on time, is the FASTN program. So if you don't qualify for public benefits, like the one-shot deal, we have a new program called the FASTEN program, and it basically is available to folks regardless of their immigration status, and it helps you stay in your home. So they'll help you pay overdue rent, help you with moving costs, security deposits, help you if you need to keep your lights on. And these are all run through home-based providers. So if you're facing housing insecurity right now, please reach out to our home-based providers to get signed up for the FASTEN program. And the best way to do that is to go to nyc.gov/homebase or call 311 and just say home base. We go to the next slide. And then again, we have a really great office called New York City's Office to Protect Tenants. So if you're facing harassment from your landlord, if you are having issues staying in your home because of inability to pay your rent, or if you just need legal representation, if you're in eviction proceedings, you can call the New York City Tenant Helpline by calling 311 and saying Tenant Helpline, and they'll get you connected to all of the housing assistance needs that you have. And a lot of these services are free, so you can get access to free legal representation and advice from our providers. And then we can go to the next slide. I apologize for speeding through this. We're just so short on time. And then another great legal service resource is Action NYC, which is a legal service that we offer through our office that is free and available to all immigrants, no matter their immigration status. So if you need immigration legal help, you can call our Action NYC hotline at 800-354-0365. They answer questions about anything that you have regarding news about, like we were talking earlier about asylum or green cards and things like that. If you have quick questions like that, they'll answer them. But if you also want to apply for a immigration benefit like a green card or a visa, you can set up an appointment with one of our attorneys by calling the hotline as well. So it's a free service, and it's available to immigrant New Yorkers no matter what their status is. And then we can go to the next slide. And then ID NYC, it is the free ID card for all New Yorkers. It is a city ID, and it's available to New Yorkers no matter what their immigration status is, as long as they're 10 and up. And it's really critical, to have an ID. It's the government issued ID, so it's really important to have an ID, for almost everything, whether you're applying for a job, if you want to open a bank account, if you want to pick your kid up from school, interactions with NYPD, So if you do not have a state ID, or you don't have access to applying for it because of your immigration status, ID NYC is a really great option for you, especially here in New York City, so you can navigate your life. So if you don't have an ID card already, please go to our website at nyc.gov/IDNYC, and you can sign up for an IDNYC appointment. And if you need to renew your card, you already have one, good on you. You can also do it through our website at nyc.gov/IDNYC. And then we can go to the next slide. Oh, perfect. I did it perfect in time. So I know I went through these resources really fast. They don't cover the full extent of everything our office offers. But if you take a look and take a screenshot of this slide, you will see that everything that I mentioned is here. And then, Carlos, if you can go to the next slide, sorry. The second bullet is our immigrant resource guide, and that has all of the resources available from our office. So if you go to nyc.gov/immigrant/coronavirus, it has everything from health insurance to food services to legal resources, a burial assistance. Almost anything that you can think of is covered in our immigrant resource guide, and it's electronic. But if you have general questions, you can call our office at 212-788-7654. or you can email us at askmoya@moya.nyc.gov. My contact is highlighted in the first bullet. My name is Asmahan again, and you can contact me at amolo@moya.nyc.gov. But thank you all so much. I'm so happy to be here. And I hope this was useful despite it being so quick.
Thank you so much, Asmahan. I tell you, chock full of information, right?
Right.
and you got it in on time.
I know, I'm so proud of myself. I was exceeding, I was looking at the time, so I'm really glad we went through it. But
I'm
yeah.
so proud of you, but the information that you're giving to us is amazing. Thank you so much for being a part of this fair, and we look forward to seeing you again. Thank you so much.
Bye. Thank you so much. Bye,
See
everybody.
you soon.
Yes,
All right.
bye.
Bye-bye. Okay, our next guest presenter. Before we begin, I would like to introduce the wizard behind the curtain, one of our case managers and our engineer for today, Carlos Rosas. Carlos, come on down. There he is. He popped in a little earlier. I think he wanted me to introduce.
That was pure accident. So
I know. I'm only teasing, but thank you so much for pulling everything behind the curtain. You're doing an amazing job. Thank you.
no problem.
Thank you very much. Okay, everyone. So before I begin, I'm just mentioning again to please put your name and your teacher's name in the chat box. If you're coming in now, please do that. Thank you. So I'm going to present this portion. As Asmahan mentioned, the city put together a lot of resources for you, which you may want to take advantage of. New York City Well is one of them. Okay. So New York City Well is a website that offers a number of well-being and emotional support applications that can help you cope, especially during this time. We're stressed. If you have symptoms of becoming overwhelmed, reach out for support and help. As Nancy Simmons from Harlem Hospital mentioned, a lot of people don't want to talk about the fact that they need to talk with someone, but we do, whether it's a family or friend. If you're isolated, reach out. They want you to help, to reach out for help. You can contact New York City Well. It's a confidential helpline for mental health and substance abuse services. They're trained counselors who can provide support, as Asmahan mentioned, 24 hours a day, 7 days a week, 365 days a year, and they in over 200 languages. So we're here to listen and help, they say, with problems like stress, depression, anxiety, or drug and alcohol use for you or someone you care for. So what I love about this service is that you can do it in the comfort of your own home. You don't have to go anywhere. You sit there, you use your phone, you text them, or you call them, or you chat with them on their website. Next. So don't wait. Connect with someone who will listen and help and who can be objective. Okay, sometimes when we speak with our family or our friends, they're a little too close to us, so they're going to side with you. But if you reach out to a professional, they can see the whole picture. They're trained. So everyone needs help sometimes. Whatever you are dealing with, you don't have to do it alone. Okay, so it's free. Free. Confidential support, crisis intervention, and information and referral service for anyone who needs help. And I think as Ms. Simmons from Harlem Hospital mentioned, there's a stigma when people start talking about mental health. There's no stigma with that. It's like going to school. You go to school for academic needs, right? Well, you can also go to a counselor for psychological need. Sometimes you have things and you need to talk about. about them to someone, that's where a counselor can come in to play. Okay? They want to help you. They're here to help us. Next slide, please. Okay. As mentioned before, any hour, any day, in almost any language, from phone, tablet, or computer. New York City Well is connected. It's your connection to get the help you need. Suicide prevention, and that's something that a lot of people don't speak about either. And crisis counseling. Sometimes you're in a crisis and you don't know what to do. Who do you go to? Sometimes you don't want to go to your friends or you don't want to go to your family members because you feel nobody's going to listen to you. You reach out to them. Peer support and short-term counseling via telephone, text, and web. When they say peer support, that means if you're isolated, there are a lot of people who are isolated. They don't have family members to talk with all the time. They don't have friends that they can see outside. They are in their apartment, in their home. This is a perfect opportunity. Referrals and warm transfers to other services. If there are other services that you need in addition to this, they will help you. Also, follow up. They'll follow up to check that you've connected to care and that it's working for you. This is you have your very own counselor. What's better than that? I think everyone should have their own mental counselor. Okay, next slide, please. They can help you with anxiety. Sometimes you don't realize that you have anxiety. When I first went into school, I had anxiety because I was scared. I called them and I chatted with someone and I got the assistance I needed to kind of quell my nerves. If you need help with depression or sleep, sometimes you're having trouble sleeping, right? Because there are things going on in your mind that are troubling you. Peer support, self-care, recovery, and more. Next slide, please. Okay, so once you go onto their website, this is what it looks like. Okay? COVID-19 digital mental health resources, because right now they know that people need help during these times. It's free digital mental health resources for the duration of the COVID-19 pandemic. Now, when they talk about digital mental health services, they're talking about once you go onto their website, you can just click in for the services. And then they have a whole list of information. You see on the top of this page, you will see it says find services, app library, coping and wellness, crisis services, and so on. Next slide, please. So when you click into the first one that says find services on the top left, this is what pops up. No matter what you're dealing with, there are people who can help. Search their database for locations that you can, get services from. All you need to do is over here on the bottom, it says, I'm looking for help with, and you say, counselor, mental health counselor. When you click in the button to search, then it'll download information. It'll give you the locations for you in your area that you can choose from. Next slide, please. So you say you want help with anxiety? Here's their digital mental health resources. So you can just click in any one of these and up will pop their website for you to get help. This is all free. Free, free, free. You know me. I'm into free, free, free. So these are all the locations: Headspace, Shine, Calm, a mindful app that provides free lists of curated meditations specific to COVID-19 via video and audio. Now, again, I'm mentioning it's in the comfort of your own home. You do not have to leave. Okay? Look at the other one, COA, All Mental Health, Ginger, strategies, activities, and articles to help users stay grounded during COVID-19. We need this help. Next slide, please. Here's others. Depression. They have two right here that you can click into to get the information. Sleep. There you go, two. Big health sleeping. Do you know that without enough sleep, your blood pressure goes up? Sleep is one of the largest components of blood pressures not being as stable, besides your diet. But they have a digital therapeutic for sleep, fully automated yet highly personalized digital sleep improvement program, accessible via app and web. Okay, look at the peer support. Support IV, free chat support. You could just chat with someone. It's like, how are you doing? I'm having trouble with this. They chat back and forth with you. Okay, NOD, resources for students for socially connect and reduce loneliness during COVID-19, as I mentioned. You need to be able to connect with people. It's a very isolating time right now. Also, look at the next, recovery. These are people who need support for recovery to maintain your sobriety, okay? So they're all here for you to use, and please take advantage of them. Next. Okay, so on the top, if you click on the coping and wellness tips, the menu pops down. It's tips for staying mentally healthy. Know when you're stressed. Take a deep breath. Full body relaxation. Less stress in under a minute. Bring mindfulness to life. So you can click any one of those into any one of those and get information on something that you're specifically interested in. Free digital mental health resources. So go for it. Next slide, please. Here's another one on the top. If you click on crisis services, this is what pops down. If you're in a crisis, you need to know who to call. There's a mobile crisis team who will jump in the car and get to you if you need help. There's crisis respite if you need help going somewhere else. Helping friends or family in a crisis. These are all good information to have because sometimes we don't know how to deal with crises. Here's a safety plan. Here's crisis plan, psychiatric advanced directives, and also home-based crisis intervention. These are good things to know because they're not in our everyday life right now, or they weren't, but now we're faced with knowing a lot more information or needing to know a lot more information than we were over a year ago. So this, I like their website. It's very comprehensive. They have a lot of information. So next slide, please. Okay, here's another one for providers. Mobile crisis team, health, home and community-based services. Become a part of the Zero Suicide Initiative. Learn from suicide attempt survivors. Provide updates and additions. Yeah, that's the word, additions. Okay, so good information. Next slide. Okay, great. So there are many different ways that you can reach New York City well. You can talk, text, chat 24 hours a day, 7 days a week, 365 days a year, as they stated, in over 200 languages. So call New York City Well today. Here's their phone number, 1-888-692-9355. Okay. Interpreters are available. So if you need assistance, you let them know. You stay on the line and you will be connected with a counselor who can connect you to a translator services. New York City Well counselors are trained to accept calls from deaf and hard of hearing individuals using video replay services. How many organizations do that? So that is fabulous. That's fabulous. This is such important information to have. And here's the website below there that you can click into, New York City Well. The city knows how important this information is, and that's why they created this for us. So next slide, please. Okay. Here's the information as well. So on the left, it says, call NYC Well. You can chat with them and you can call them as many times as you need to. Okay. So in English, it says here, 888 area code 692-9355. Then you press 2. Okay. You call 711 to relay service for deaf or the hard of hearing. For Spanish, you dial area code 888-692-9355 and you press the number 3. Okay, and as I mentioned earlier, interpreters are available. You stay on the line and you let them know. Counselors are trained to accept calls from the hearing impaired individuals using video relay services. And so you know, again, this service is free, and it's confidential. None of this information goes to your family, goes to your friends, goes back to your school or your job. You can also text on the right-hand side, text well. It says text well to 65173. And you see for English, prompted, when prompted, text 1. For Spanish, when prompted, text 2. For Chinese, when prompted, text 3. Again, interpreters are willing and ready and able and trained to connect with you and assist you. Chat with a counselor now, right? When you get off of this resource fair, you say, I think I'm gonna call right now. So just know, call, text, chat. The chat is done when you go on their website. You can just chat with someone like an email. They go back and forth. Okay, so if you need support and prefer to chat, New York City Well Chat is here 24 hours a day, 7 days a week, 365 days a year. And please take advantage of these resources because they're here for you. Thank you so much for listening. And Carlos, we can go to the next presenter. There we go. So, whew. We're halfway there, people. We're halfway there. Our next guest presenter is Leandra Paulino. She is a traffic enforcement agent in the recruitment section of the New York Police Department. Please welcome Leandra Paulino. Come on in.
Good afternoon.
Thank you for joining us. Thank you, thank you, thank you.
Thank you for letting me be part of this event. I'm so excited. Thank you, everybody, for being
All
here.
right. Enjoy.
Thank you. So, good afternoon, everybody. My name is Leandra Paulino. I'm a traffic enforcement agent of the New York City Police Department. Also, I'm a recruiter from the recruitment section also. And I will just talk about other services that we offer to the community other than recruiting for police officer, traffic enforcement agent, school safety, cadets, and more. The police department, we have a variety of different services that we offer to the community for free, just for the community. On the next slide, please. Okay. We want to know in the police department what we're looking for, what we're committed for in the department. So the New York City Police Department, it's a diverse agency. It's one of the most diverse police department in the United States. And what we look for the people, it's that they have is courage, passion, compassion, respect, honestly, and committed to the service. If you have all that, it's what we need from you. We also need people for all languages, all dialects, skills. But the most important, we need people that have a heart, that have a passion for the police department. Next slide, please. Okay. As the NYPD engaged to the community, we offers many jobs to the community, many opportunities to the community across the city. It's citywide. It is important to be a people person in order to be a good police officer. What it means, we need to have a heart. You need to have a passion for the job. It's not only a job, it's a career. It's not only what you wish for. It's something that you're going to take from a long journey. So for those people that says that NYPD is not for them, guess what? Those are the people the department is looking for. This job is for you is if you have a heart. That is what I always say to my recruiters. If you have a heart, the job is for you. Okay, and in the community, we in the NYPD, we know and we understand other people's needs. Okay, so we go to the next slide. Okay. One of these programs that now the NYPD is offering is the Youth Summer Program. It's for those children, those boys and girls between 12 years and 16 years that love sports, they love interacting with the police officers, with the community. They need to be engaged more. This is the great service for them. If you have children, if you have siblings, they wish to be engaged in this is a great program. Just start now. You just go to a local precinct, go talk to the police officer, go to a neighbor coordinator officer. They will be glad to help you for this program. Okay, next slide, please. Thank you. Okay, this is more information about the slides. They started in June 22nd, and it's an 8-week program. It's for the whole summers. You can practice sports. You can engage with other people in the community. You receive mentoring, and it's in a league. You play with teams across the city. We play with other teams, we play with other precincts. It's a great program from them. And remember that, like Ms. Sula Haska says, it's free. It's for the community. It's for the kids. Okay, next slide, please. One of the great units that we have in the NYPD, it's community affairs. It's the great unit that interacts with the whole community, with neighborhoods. It's always there. You see them in these dark blue polo shirts and the hats, the NYPD hats. You always see them talking to the community, interacting in the events. You always see them right there. They have many programs. Like one of them is Operation Safe Child. Like you see there, they go to these locations and they go with a police officer and they go to the community to try to give them like an identification card for your children in case your child is missing, you don't find your child. They give you this these identification cards with information of your child, along with the gender, the date, and there's a picture in there you can always carry. That is the easiest way for them to find it. Also, the operation conversation with cops. We have events like meeting with cops. Then we can have a coffee with a cop. We can have a one-on-one with a cop, with a police officer. And just to interact, just engage, because that's our main goal. Engage with the community. The more we engage, the more we can trust you, the more we can trust them to us. So it is very important to create a relationship with the community, because we will know what the community needs. What is the main thing about, what is it important to have this thing about the community? We will know what the community needs. Okay. Also, we have this character. I love it so much. It's the crime dog. It's usually in the events for a school presentation for the kids. They love it. They also taking pictures with them. They're also in presentation. They also along in some events with recruitment, and they teach us about the dangers about drug abuse, criminal behavior. They also teach us about how to protect from bullying and all other prevention crimes. Okay, next slide, please. Okay, it's more about the Summer Youth Police Academy. This is all about the Summer Youth. I'm gonna just resume about it. This is a program for children between 10 and 15. Also, and they train you like how to become a better person, how to engage more with the community. This is all the information about they need to live in New York City. It's from 8:30 to 2 p.m. They do the police officer, they instruct the students, they teach them about the role plays, how to prepare about respect, courtesy. They teach about their job. They go to field trips also. They go to amusement parks. They engage also in military dreams. They learn a lot. Because everything starts when you're young. Everything starts in the community. Everything, like they say, starts at home. But we can also start this program since they're young. So I think it's a great program for them. They teach them a lot. They encourage the young people to take part, just to teach them about the law enforcement and many more careers in the NYPD. So for additional information, it's the link is right there. The phone number is also, it's 718-312-5079. And the application deadline is after is before May 31st. So you still have time for those who have children, siblings, they can apply to this program. They will love them. All right, so next slide, please. Okay, this is information regarding the Youth Police Academy. Also, we have the Explorers program. This is for kids between 14 to 20. We can go to the next slides. Okay. The Explorers, they offer to the youth, they teach them the value, the importance of being part of the Explorers program. It's about law enforcement. It's about discipline. It's about integrity. It's about respect to each other. This is more for teenagers who wish to become one day in the future a police officer, a cadet, a traffic enforcement agent, a school safety, a 911 operator, an investigator. This is, I would say, the best for those people, for those kids who love law enforcement. They teach you discipline, respect, they engage with the community, they go to many events, they love to do the training, they involve in many community service, they go to all areas, all citywide. They also, as the youth program, they compete each other with prisons, they go to field trips, they also mentor other kids to follow the path of law enforcement. So it's a great program, and it's free. You just need to go to the prison. You just need to go to a police officer and ask about this program. They will glad to help. It is really for the children now that is summer. Next slide. Okay, I was explaining here about the police explorers, the positive results. Everything is about them and the community. They choose their own officers. They also got promoted to ranks, and they are, like I say, they mentor others to continue the path. So we call them the young officers in the area, and they allow to, greater opportunities to build positive relationships with other people, not only in the NYPD, but with the communities. Next slide, please. I think I explained all about the explorers. So the great question is it for me? The NYPD is for me. Yes, I think it will. Anybody can be a great fit for the department, for any career in the department, not only for police officer, for traffic agents, for explorers, for those who want to join, because you have this opportunity to serve the community, to work with people with all different background, cultures. You meet people that can be your forever friend, that can be your pal, whatever you call them. That will be the person that is going to be for you, your partner. You keep New York City safe from crime. We offer competitive salary, benefits, always. The promotionals, always. Whoever is in traffic enforcement, school safety, a cadet, 911 operator can take the police officer as a promotional opportunity. They also all promotional opportunities, supervisors, lieutenants, sergeants, who knows? There is a career variety in the NYPD. If you don't like to wear the uniform, not a problem. You can be an investigator. You can be a police administrative aide. You also can be a timekeeper. You also can be a crime analyst, evidence and property. It can be any career. Name it, we probably have it. Who knows? Next slide, please. This is our main goal. Why we need to engage in the community? Because we want to build trust. We want to know your needs. We want to know what's going on in the area, what people need. They need more officers around. They need that they're listening to what's going on there. We're here to help. Through these events, through these careers, through these programs, we want to build trust. We want to have this time relationship with the community, with the neighborhood. We also probably will live there. Where you live, a police officer probably live there. Who knows? We need to connect with the people, not only with the young people, the older people also, anyone. So we always empower the neighborhood residents to have a role in reducing this crime and protect each other. But always there should be a trust. There's always need to be a communication between the police officer and the community. That's what we always said about it. Okay, so next slide, please. Okay. So these are our resources. You can call us anytime. I'm a recruiter. I'm almost in the chat. This is our website, nyc.gov, NYPD. You can find a lot of opportunities about information, about careers, exams, opportunities, all this information, salary, our benefits, everything, pension, unions, everything is there. Also, we have this 212 recruit. We are available 7 to 8. I'm one of them answering the calls. Any questions that you need, let us know. I speak Spanish. If you speak Spanish, that's no problem. I will be there taking your call. There is another recruiters who speak Spanish also. I have one in French Creole. So this will be great. If you need anybody to speak in these languages, letting us know. I will be there, and any recruiter will be there. Also, on Facebook, we do lives. On Facebook, on NYPD Recruit, we also posting about these exams, these careers opportunities, about programs, exams, everything about the department is on Facebook, Twitter, or Instagram. Today, there is a live also. My recruiters, we also do every Thursday at 1 p.m. We do these lives. Any question regarding the exams, upcoming exams, investigation, processing for hiding, it's always in Instagram at NYPD Recruit at 1 p.m. All right. So if you like after this, you can join us at 1 p.m. for the live. All right. My partners, another recruiters will be there answering for you. I will be behind doing the chat. Like I'm saying in the chat, if you find my name, Agent Paulino, this is me. All right. So I will be gladly for any questions that you need, Spanish, English, I'll be there. All right. Next slide, please. General recruitment questions, 212 recruit. Any questions that you have regarding any exam, any program, any resource that you need, any questions will be there, 7 a.m. to 8 p.m. All right. For those who already are on the process, who knows if we have anyone doing the process for traffic, school safety, cadets, police officers, 911 operators, call this number 718-312-4226. Any question regarding, we will help you also. There are investigator, police officer, detectives that will be there helping you with all these questions. All right. So for any reason, any of those can call to recruit. I will be there, 312-4226 for hidings, exams, or any other process that you are to be hired. Okay, so it was my pleasure to be here with you. It was an amazing journey, and I'm proud of be part of the NYPD and letting me be part of this event, telling you all about these opportunities. And I wish I could have the time to explain you about more, but just call us, follow us. We will let you know all about this. All right. Thank you so much for this opportunity. It's been a pleasure. I wish you to stay safe, be safe, and enjoy this beautiful summer that is coming. All right. Thank you so much. Back to you, Ms. Sula Haska.
Thank you, Agent Paulino. There goes Sula.
Thank you so much, Agent Paulino. Good information that you gave. Thank you. Please, thank you for your service as well, because you're out there on the front line and keeping us safe, and we thank you.
Thank you, Ms. Haska. Thank you for this event.
You're so welcome. Be safe, okay?
You too as well. Thank you so much.
You're welcome. Thank you. Bye-bye now. Okay. Good information, right? A lot of, who knew all the service that the NYPD had that are free for our children, for the community? Great information. Okay. We're almost there. Almost there. Okay. The next slide. And of course, I'm your presenter. It's LIFE, which stands for Living for the Young Family Through Education. It's the LIFE program. Now, in particular, this is the LIFE program at Harlem Renaissance, which is in Harlem, in our location. It's under the New York City Department of Education. Next slide. Now, some of our students might be familiar with this. Some may not be familiar. If you have children who are in a certain age range, then you may qualify for the LIFE program to have your child be taken care of. LIFE is high quality early childhood education and support services for student parents. These are for the students who are in our schools. And since all of you are in our classes right now, you may qualify for this. So the Living for the Young Family Through Education, or the LIFE program, offers the children of student parents free, high quality, early childhood education. It gives student parents academic support. It also helps student parents graduate from high school or complete their high school equivalency. It also allows student parents to advocate for themselves. Next slide. So what is LIFE? It's a Department of Education program, again, that provides free early childhood education to children of student parents. You know, LIFE makes it possible for the parents to stay on track towards graduating from high school or completing their high school equivalency while parenting. In addition, LIFE supports student parents' transition into parenthood by providing high quality early childhood education, supportive counseling, academic guidance, and advocacy services. It's a good program. Next slide. So what does LIFE do? Here again, it's the same information. Their goal is to empower student parents to achieve their education and parenting goals by providing counseling, referral services, and advocacy. In addition, they provide a community of support and partnership for family members of student parents. A lot of times our students have difficulty finding childcare services. This is something that may work in your favor if your child is in a certain age range. So we're going to give you a little more information there. Next slide. So once you go, if you type in your Google or your Yahoo or whatever platform you're using, you type in LIFE. This is something that will pop up. It says LIFE program and NYC. You can click into any of these locations, contact, mission and vision, meet our team, about us, enroll. This is really good information. They give a lot of information on their website. So I'm going to take you into their website so you can get a little peek on what it's about. Next slide. So you see at the top, it says LIFE, and then it says home, about us, enroll, locations, contact. You can click into any one of those words and up will pop up information. LIFE serves 600 plus children ages 6 weeks of age to 4 years of age. They also have 30 plus locations across the 5 boroughs: Manhattan, Staten Island, the Bronx, Queens, Brooklyn, right? It also has it's helped 3 generations because of this service. Keeps the student parent on track with continuing their education. So it's a great service. Tap into it and it's free. Free, free, free. Next slide. So, as I mentioned, if you click on that word locations, this is what will pop up. So as I mentioned, it's in the 5 boroughs. All you need to do is enter your zip code in, and you need to let them know about what is your radius. 1 mile you're willing to go, 3 miles. Once you click in the search, it will then pop up all the locations that are available to you. And you will see it, such an example, on the right-hand side, it says Bronx and all these locations. If you click into one of the locations, up will pop the name of that location and their address and their phone number and their website. And all you need to do is give them a call. In addition, if they don't have any openings on this at the site that you are choosing, that you're selecting, you can always ask them to find you another location. They are willing to assist you with that process. Okay, so just know you're not going to be alone. They'll give you referrals to another site that's close to your home. Okay, next slide. Do I qualify for life services? Do you have a child between the ages of 6 weeks and 4 years old? And the child is not eligible for pre-K, then you qualify. Are you enrolled or are you interested in enrolling in a New York City Department of Education school or program? Then you qualify. But since you all are here in classes, you qualify as long as your child is between 6 weeks and 4 years old. If you answered yes to both of these questions, then you qualify for life services. Next slide. So, what documents do you need in order to enroll in life? You need your child's information. You need your current academic schedule. You need a copy of your child's immunization records and medical examination form. And you need an enrollment form. And I'm going to show you what it looks like once you go into their website and you go into enroll. Go into that link. Next. So this is what it looks like, how to enroll. See in the top, it says gather the documents. Gather your child's proof of age, a current child's examination form. And they give you all the forms here. A current record of your child's immunizations, your current academic schedule. And you can get that by, there's a form that the school has that you need to make sure your teacher completes to verify that you've been in his or her class. And then the office will generate a letter for you. Okay? Complete enrollment form. It's in all those languages there. So you need to download it and complete that. Then you have to find a life classroom, but you're already in a classroom. So that's done. Then to enroll in life, you need to contact the life staff member of your preferred location. Remember I said when you click in the location and you select the location, then you would contact that location. Okay? And at the bottom it says meet with the life team. And that's helpful because they want to know about your child so that they could service you the best way that they can. Also, you need your child's flu shot, but they're going to give you all that information once you open up all the forms that you need to complete. Okay, next. So here's the child and adolescent health examination form. So this is all the stuff that you need to complete and submit to them in addition to other forms before you are enrolled in their program. Okay, it looks like a lot, but they can help you. Next. Eligibility and enrollment checklists. So these are the following documents that will support your child's eligibility and enrollment in life. So these are some of the documents that you can present. You provide only one copy of the following: the birth certificate, the passport, record of baptism, a hospital or health record. You choose which one you are going to submit. But what I suggest is have two ready, have a backup plan. Always have a plan B. Always have a plan B. Okay, next. Now you need your documentation. Provide a copy of your current academic schedule. As I mentioned, you can get that from the main office. The third is you have enrollment documentation. These are the documentations that you need to complete and submit upon your child's enrollment. Okay? And it's in on their website, the Child and Adolescent's Health Examination Form, the school meals flyer, residency questionnaire, the federal parent/guardian student ethnic and race identification form. Okay, this is information that you need to submit. Next. Okay. Questions about enrollment? You can call the Life Central office at 212-609-8520 or visit the Life website at lyfenyc.org. So to find a Life location near you, to connect with a Life team member directly. So if you're not comfortable using the website, you can call the office directly and get assistance that way. Next. Okay, here you go. You can connect with through the website, through email, through phone, through Facebook, through Twitter. There you go. You're almost there. So take advantage, okay? Take advantage. Free, free, free. Okay. I hope that you've taken pictures, you've taken screenshots. You can view this video again. Thank you so much. Okay, we have the next present. Okay, this is fabulous. I came across this. It's Box. It's something that the Reebok is a sneaker company. This is something that they created in order to get children moving, and it's free, 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 free. Next. It's a free physical activity program designed to get kids active and establish a lifelong commitment to health and fitness. Especially with this pandemic, too many people are sitting and they're inside, they're working remotely, they're gaining a little weight. They want to keep children moving, and we need to be moving with them too. That would help. But this is a wonderful program. And they also provide a program for schools, so that the schools can pick this up. But for us, it's for parents can also access these activity programs and materials. Next. Okay, it's a free physical activity program for kids of all ages and abilities. The Box program was designed to provide more opportunities for kids from early childhood through high school to get moving throughout the day with movement breaks, games, activities, and more. That makes me want to stand. That makes me want to stand right now. Next. Who can use Box? Parents, teachers, volunteers, physical education leaders, or anyone else that wants to help kids get moving. What do I do when I sign up? You gain access to all their free resources created over the past 10 years of schools and organizations. Resources include lesson plans, videos, printouts, training modules, certifications, and more. Age groups. There are resources available for early childhood, elementary, middle, and high school audiences. Next. Languages. The resources are available in English, Spanish, and French. So to get started with Box, you just sign up for free. Next. So these are some of the things, once you sign up for free, these are some of the things that you'll see. A monthly fitness calendar. This is all free. You click into that. It gives you a monthly, fitness calendar so you can keep track of all the activities that you're doing, the times, what kind of activities you're doing. On the bottom is Are You Game? This resource is full of fun and challenges and games and crafts and puzzles and activities to do at home or in school, if the school is going to adopt this program. But you can choose for over 30 activities to help you and your kids get moving. It's all about getting moving. Next. Here's elementary and middle school physical activity plans. These plans are fun and engaging, incorporating functional fitness skills, running, games, mindfulness, and nutrition talks. On the bottom, Box Lessons on Demand. These on-demand physical activity plans each come with follow-along videos that will keep students moving in the classroom or at home in their environment. Next. And all you do is click in, and you have access to all of this. So mindfulness and movement flow. This resource includes breathing, mindfulness, movement flows, stretching, and gratitude exercises. It makes me aware that I need to do this. We all need to do this. Okay? On the bottom, Box Bootcamp. These lessons, complete with videos, will strengthen, support, and empower young adults physically and mentally. Fabulous stuff, everyone. Come on. This was a find. Next. Healthy recipes for when you're cooking. There you go. A compilation of cooking recipes that kids can create on their own. So this is a way to get your children involved in healthy eating. Okay? With easy, straightforward directions and minimal use of kitchen tools. Oh, we like that. On the bottom, it says activity trackers. These are page activity trackers are intended to be used by school classes or by kids at home to keep track of their weekly and or monthly physical activity. Fabulous. You need to keep track. Just like you need to be mindful of what you're putting in your body, how much you're putting in your body, just so you can stay on a healthy track. Next. Here's the information. Okay. Here's the Box website. boxkids.org, about Box, about us, you know. In addition, because you have to sign into this, here's the sign up page, the sign up website. But if you go into Box, about us, you will also find the link to this, to signing up. It'll say sign up now, and you can do that. Fabulous information from all our guest speakers, all our guest presenters. We had a wonderful day today. Next. Thank you, thank you, thank you. I would like to thank a few people on behalf of Mid-Manhattan Adult Learning Center. I would like to thank you again for being a part of this virtual fair. I'd like to thank our guests for their presentations and their efforts to support our community. I'd like to thank Maurice Held, Nancy Simmons, Henry Orbe, David Perez, Emma Myers, Asmahan Malo, and Agent Paulino. They took time out of their workday and their own personal time to create these PowerPoints for you and for us and for our community, because they know how important all these resources are. A special shout out to Carlos Rosas for his calm demeanor and his engineering skills. He made the magic happen. He made the magic happen. And to all those who contributed, people who are taking attendance, people who sent out the email blasts, you know, all the teachers at Mid-Manhattan and the administration staff. As you can see, we have a lot of people on our team. So do me a favor, go out and share this information. Everyone is a learner and then a teacher. So once you know something, it's your obligation to teach someone else. I see people in the chat box, Viviana thanking. Thank you, Ms. Parker. Thank you. So we want you to go out, make it happen. View this video again, please, because there's a lot of information that was given today. We hope that this was informative. I hope that you took a few pictures or some snapshots. And please just use the same link that you used to get into this, to view this virtual fair again, because these are very important and useful information. Heather, thank you. You are so right. That's what that came straight from Heather. Thank you, Heather. Malida said, very good information. Loved it. Thank you. Appreciate that. Appreciate that. So I hope this was helpful. Thank you for this wonderful information. Darren said, Darren, he attends a lot of our podcasts, and I thank you, Darren, for doing that. Allison is saying, great information here. You're so right. You're so right. So share it with your neighbors, share it with your family, share it with your friends, and we'll see you next time, okay? And here are all the people at Mid-Manhattan Adult Learning Center, our principal, Gloria Williams, Nancy Fernandez, our assistant principal, Lisa Henderson Dupi, assistant principal, Jean-Claude Dorelis, assistant principal, and myself, case manager and event coordinator, and Carlos Rosas, case manager and event engineer. Thank you again, and we'll see you next time. Bye-bye.